In adults with coronary artery disease, how does adherence to a DASH diet compared to those that only adhere to a fitness program reduce the chance of myocardial infarction?
Our team chose coronary artery disease and to write about it only because it's got such a high prevalence in the United States, unfortunately, being like one of the leading reasons for mortality. Coronary artery disease specifically is actually the most common of the cardiac issues, and it's also an issue on a global scale.
Physical activity is shown to have beneficial effects to not only weight control, but also keeping systolic figures down and increasing HDL cholesterol.
An increase in saturated fats and sodium has been the hardening of the arteries, and that has often led to myocardial infarctions, one of the leading causes of death right now in Americans, and is a huge contributor to cardiovascular disease.
DASH is an acronym that stands for the Dietary Approaches to Stop Hypertension. It's just kind of a very broad and general term for these non-pharmacological interventions can be used to control or lower blood pressure, less things like red meat. We're focusing on these modifiable risk factors so that we can have better outcomes.
How should we disseminate it? That going into public schools and speaking with kids about it and just educating them on eating healthy, go home and teach their parents.
That would kind of tie into our primary prevention, where we're actually working to prevent cardiovascular diseases.
Continuing education, like seminars on dietary. Dietary is going to be crucial. Cardiovascular team, especially the nurses who are going to have the most interaction time, the aides as well, the technicians. Let's get them all in there. What do you think about that, Cheryl?
I agree. Especially for the doctors, they say about 38% of them are not qualified to teach a healthy and effective nutrition plan. We collaborate, teach them about the DASH diet.
Share with patients with hypertension or atherosclerosis.
For any American who's lived their life adhering to a certain diet to have to go and modify that and change that. Change doesn't just easily happen overnight. In access to fresh and healthy food, if you live in a food desert or you don't have money to access healthy foods, that can be a huge barrier.
This is going to be the factor of money. By socioeconomic stats is just with the monetary concern as well.
So we should probably consider not all patients or doctors actually understand how to provide information on proper nutrition, proper physical activities. Not everyone's situation is going to be the same.
Some ways we can overcome these barriers is to just get our community involved, try and seek out those local farmers, go to your local farmers markets, find your local food pantry, and just, getting your community involved and trying to see what resources you do have out there to help you combat this.